Dr. Steve Frost of Monument Health is an anesthesiologist who helps patients with trigger point injections. He says it starts with a physical examination to find the trigger points.
Sometimes we get a local twitch response that muscle actually contract by itself. Other is what's called a jump sign, which is exactly what it sounds like. The patient will jump when you touch it. And then sometimes they get what's called a referred pattern pain and doesn't actually follow a nerve or dermatome level. It's just an area of where that pain is.
After the trigger point is found, the injection follows. Dr. Frost says there are multiple ways to handle an injection.
Usually what we do is we inject local anesthetic like a dentist would use, with or without steroid, or you can use normal saline like we use in IV solutions just by itself.
Another injection used is one where you don't inject any fluid. Dr. Frost calls it Western acupuncture, or more commonly known as dry needling.
What happens is your own body sends its own mediators to actually relax, straighten out that muscle, and actually the increased blood perfusion over that trigger area will take away all the metabolic waste that's been stored up there since it's been contracting so long.
Dr. Frost says when injecting the anesthetic, the patient would receive relief for weeks or months. However, as of April 1st, 2024, Medicare changed the rules when it comes to trigger point injections.
A lot of my patients I would see on a every month basis, but now Medicare has, again, changed the rules, and they are only allowing us to do it 3 times a year for a patient.
Dr. Frost says this has changed how he sees some patients, but one thing has remained consistent. Physical therapy is needed after trigger point injections.
If you don't use it, you lose it. And the whole concept is to break that pain generator cycle with the trigger point injection, relax the muscle, and have the therapist work with them in that affected area to where it does not become a chronic problem.
Dr. Frost concludes by saying the quicker a trigger point can be treated, the better the chances it doesn't become chronic, which he says is pain lasting around 2 months.
If that pain sensation continues, not only does that tight muscle contract all the time, but it affects the pain nerves that go to the spinal cord, and actually the spinal cord gets used to this signal, so it doesn't take much to cause a chronic pain.